Check your spinal alignment and flexibility. Begin by checking your spine for common alignment problems. Stand as normally as you can. Look in a mirror or ask a friend to check. First, check that your head is directly above your neck. Maybe it's too far forward. Next, check the way your spine curves. You should have 3 curves in your spine: the lumbar curve, the thoracic curve, and the cervical curve. The curves should look like this in a normal, healthy spine. Check whether you have any lordosis, too large a curve in your lumbar spine, or any kyphosis, too large a curve in your thoracic spine. Or maybe you have developed a flattened lumbar curve, with your pelvis tilting back. Or maybe you have a sway back, where your pelvis juts forward, which also makes your thoracic curve more pronounced. Now check the flexibility of your spine, and of course your muscles. First of all, start by bending forwards. Roll forward slowly, rounding your back and bringing your arms towards the floor. Forward bending involves spinal joint and hip flexion, along with the muscles and other soft tissues of the back of your body. When people have trouble bending forwards, they automatically assume it's due to tight hamstrings, but it could also come from an issue in your low back. Then roll back up slowly, as if you're stacking vertebra on top of vertebra as you come up. Now check your flexibility in bending backwards. Inhale, raise your arms above your head, keeping your arms close to your ears, and then bend backwards, looking up at your hands. We bend backwards far less often than we bend forwards, so you'll find it more difficult. As well as flexibility in the spine, back bends require flexibility in the shoulders and hips, and you also need strong core muscles to support you in the bend. Next, check the flexibility of your neck and cervical spine. In a slow and controlled way, look up towards the ceiling, and then slowly look back down towards the floor again. If you have kyphosis, or stiff neck or shoulder muscles, you may find it difficult to look up towards the ceiling. Now check your flexibility in bending laterally, to the side. Without moving your lower body or your hips, slide your hand down the outside of your thigh towards your knee. See how far you can reach down without bending forwards or backwards. And then slowly bring your hand back up again, repeating the same action on the other side. Notice if you can reach further down one leg than you can the other. Your side muscles and your hip muscles will affect how far you can bend laterally. As well as bending, our spine also rotates. So now we're going to check our ability to rotate our spine. Stand with your feet slightly apart and raise your arms up to shoulder level with your palms facing towards each other. Without moving your lower body or your hips, move your arms around, rotating your upper body. Make sure that your palms stay facing each other. If they come out of line, then that's as far as you can rotate. Check to see how far you can rotate in each direction, comparing each side. Can you rotate further in one way than you can in the other? Repeat these exercises regularly to see if your flexibility is improving.